Hello everyone, I am Dr. Anish. In this video, I am going to demonstrate you the AC joint stabilization. Place the patient in a B chair position. And instruments for AC joint stabilization are 1.5 mm guide wire, 3.5 mm cannulated drill bit, and then this handle comes with an oblong button, a clavicle button, and a 5 size fiber wire and a knob. By rotating the knob, we can deploy the oblong button. Coming to the procedure, we mark incision in line with the coracoid. We can nicely appreciate the type 3 AC joint. So starting the incision, we feel the anterior border, posterior border, and then mark the center. Clear with the periosteum, feel the center of the clavicle, and after you introduce an 1.5 mm guide wire, start drilling with a 3.5 mm cannulated drill bit. So under control, drill all the 4 cortices, 2 in the clavicle, 2 in the coracoid. Make sure you take every CM shot for every cortices you pass. Once you are done, so once you pass it, gently tap with a mallet until it passes through the coracoid. So by rotating the knob, you will deploy the oblong button. Unwind the fiber wires from the handle. Move the handle gently, and then just by cinching both the threads and applying a firm pressure over the clavicle, you can nicely reduce the AC joint. So now this is the final picture.
ArthroKey, a product range by RK. Quality you can trust.